Hello and welcome. This is Dr. Liana Lianov. I'm the president and founder of the Global Positive Health Institute, and welcome to our GPHI podcast series where we talk about all things related to positive health, positive psychology, lifestyle medicine. And today I'm delighted to have with us as our guest Dr. David Fryburg. He's a physician scientist who runs this nonprofit called the Envision Kindness. And the mission of the nonprofit is to promote kindness, connection, and joy in healthcare and beyond. So welcome, David.
Thank you. It's a pleasure to be here.
Well, lovely to have you. And I've just, ever since I first found out about what you do, it fascinates me. And I'm really excited to share this with our followers and listeners. So tell us a little bit about how you first got involved in setting up this kind of nonprofit that is focused on this area that is so important to positive health, positive psychology, health, and well-being.
Well, thanks again for the invitation. And I sort of have stumbled into this, honestly. I had had the privilege of having a variety of stops along my career. I've been faculty in a medical school and worked in pharma, in translational medicine, and then worked as a consultant leading teams of scientists for the Foundation for the NIH. And while I was doing that, I was not in meetings and reading a lot of the news at the time. This is over 10 years ago. And I found that I got stressed and anxious in essentially dose proportionally to how much I was taking in. And the nerd in me said, oh, go look at the literature to try to understand this. And yep, there it was. But more than even that, reading about the war in Ukraine or the Middle East and feeling sorry for folks there would also spill over onto people's lives. And so that mood congruence that I learned about would affect how anxious they were about their own lives, their own family and health, et cetera. And I thought it wasn't fair. And it deprived people of a higher quality of life, and in many ways artificially. So, but I'm an endocrinologist. Like, what was I going to do about it? And I thought, well, wait a minute. What if we had images of kindness and caring and connection, really the way most people are, and we shared them with people, and we helped rebalance what I know you'd appreciate what I came to call the visual diet, said like a good endocrinologist. And I looked around, nobody was doing it. And I thought, well, do I complain about it till I die, or do I, do something? So I decided to do something. And there wasn't a model to follow, but that's how it started. And then it was a series of learnings from there.
So tell us a little bit more. I'd like to hear more about how you're using this in your own life as well as professionally and with Envision Kindness. So first, with your own life, how are you practicing this a better visual diet for yourselves?
Well, I'm more mindful about the news and what the sources are, et cetera. In my own life, I end up seeing so much kindness media and making it that I get, dosed every day, if you will. But it's the story more as to how we're using it. So it turns out that, there's the old aphorism about the giver benefits more than the receiver. And it turns out that there's, as you could imagine, physiologic changes that occur in the act of connection, of creating connection with another living being, whether that's, human, animal, it doesn't really matter from what I can tell. And it turns out that even just seeing kindness, seeing an act of caring and connection creates the same neuropsychology and physiology, which has been, for your listeners, characterized as activation of reward centers, endorphin release, oxytocin release, vagal nerve activation, all of these things that have salutary benefit. So we were in the process of, putting this together, and we started people were saying, look, you're a scientist. Don't, do studies, make this about science. And I was reluctant because, scientists are told to you stay in your own lane. I know a lot about endocrinology, but I'm not a psychologist. But we recruited psychologists who knew what they were doing. And we did our first study, and that's when everything changed. Simply put, images of kindness and caring had double the effect size, double the impact of positive or pretty images like puppies in a basket, bunnies, flowers, kittens, typical go-tos for people, on variables like love, trust, optimism, happiness, soaring increases in sympathy and compassion. And the statistician who did the analysis turned and said, I've never seen data segregate like this. And so the data screamed, pay attention. There's something really important here. So what we did is there are a lot of things to figure out because there was no model to follow. Eventually, what we came to is, in addition to learning how to get crowdsourced images from around the world, we stream them into healthcare settings, in waiting rooms, in hallways, inpatient hallways, in workrooms, and it's really quite impressive. Same things that were seen in many academic studies, like using a clip from Oprah in those studies, with something that psychologists called elevation, and which has a positive interpersonal connection. We were seeing it in waiting rooms, and we were seeing, when played on inpatient hallways, evidence of staff respecting and treating each other better. So over time, it's convinced me the reason that this works is that nature wants us to be like this. Nature wants us to help each other, and it lowers stress. It's key to buffering stress and resilience. So everything came together. What started as this very simple idea, all of a sudden, this was a public health effort because you could put the media almost anywhere. And because most, if not all, people are wired to respond to it, we don't have to teach them. We also don't have to tell them what to do. They will find it on their own. So there's a lot of applications. We're exploring them. We're looking at how it's affecting patient satisfaction, and we have some new data suggests that it does. And then taking it longer out and looking at outcomes. But there's a lot here, and a lot to think about in its course.
Well, it all makes sense from the perspective of what I'm aware of around positive psychology, healthy lifestyles, and the key component there being social connection, that we're wired as human beings to be social, and to be social means to care about other human beings. So we're wired that way. I often, when I give my talks, talk about, well, the stress is when we're really increasing our sympathetic nervous system, that fight or flight. And that with a number of interventions in positive psychology, and it sounds like these images of kindness may be doing that what we're doing is boosting our parasympathetic nervous system that has all these physiologic benefits. And the shorthand that I like for the parasympathetic nervous system goes really well with this, which is the tend and befriend part of our nervous system. And so you've been able to connect with that and do more with that, which is amazing because, like you say, it's easy to do. So tell us more about how you're structuring this, how this can be incorporated in healthcare and beyond.
Well, structuring it's a portfolio that we continuously building of short form videos. Images of kindness are the foundation that are put in like in a Ken Burns adopted method. The videos are anywhere from 15 seconds to a few minutes in duration, and they are intended for a busy area that people are trafficking through or maybe sitting for a few minutes. And it turns out that it only takes 2 minutes to get this response. It does not take very long. So where I see it, my intent in healthcare is if we can elevate the patient and we can elevate the staff, that when they come together, the quality of their interaction would improve. That can lead to better outcomes, communication, satisfaction with their care or the care experience for both groups, because a lot of the stress is artificial. There are things that need to be corrected. I don't want to, be misunderstood, but to be more clear. But it's really, they walk in, each of them are walking in with their own stressors. How do we help them just get to a better place? And that's exactly what you just said, and spot on. Everything seems to be tied to the parasympathetic system. Where we're going with it, the intention is healthcare is an important place and probably one of the most stressful circumstances that most people will be in. But we also see it in schools. We're actually in a university now, and look at it for other places. But for your listeners, in your offices, if you're playing the news, I would not do that. Even we don't have to talk about kindness media. Don't consider doing that. And some people have gone to home and garden TV, but if you actually look at it, while it's certainly not as stress-inducing as the news, it can induce envy in people because there are lifestyles or habitats, if you will, that many patients will never be able to afford. So my recommendation is think carefully about that. Educational media is very helpful, but should also be considered as how it's delivered, because it could be fear-inducing. So what we do is we suggest to folks, please mix it with your own media, and to get the patient comfortable. From there, we're also looking at or interested in studying specific indications or applications of the use of the media. And just as a note for folks, if you haven't read the book Compassionomics by Steve Trzeciak and Tony Mazzarelli, you might consider doing that. It's how caring affects outcomes. And then in their second book called The Wonder Drug, they're talking about kindness as the wonder drug. And I would agree wholeheartedly with them in that kindness has a pharmacology that's unequaled by any medication that I know as a general therapeutic. But that's sort of where we're going. There's increasing interest, and more hospitals are using it and practices. And we even had one dental office that we're in turned patient gave unsolicited feedback. We actually got a large amount from them. And a patient comes and just sits in the waiting room when she doesn't have an appointment, because she just wants to see it. And the dentist has talked about how it's changed the emotional tone and the sense of well-being in the practice. And to me, that's just thrilling. That is absolutely thrilling, because ultimately we all went into this business to have people lead better lives.
Fascinating. Lots of thoughts going through my head. For example, and I think you've mentioned this before and other times when we've spoken, that this exposure to these kinds of images is easy. It takes no effort on the part of the consumer of this kind of intervention, and we often in medicine, of course, are prescribing different things, and we may want to recommend, of course, to our patients to at home, in workplace, school, to immerse themselves in better images, to think about that choice, the visual diet. But even if short of that, if we can create this kind of environment in our medical healthcare settings or other settings where the managers are thinking ahead to how powerful this can be, that the people that are exposed to it, like say for a minute or 2 minutes, a short amount of time, get that benefit. And I presume we need more research, but I would imagine that that can have some lasting effects. And also have, you mentioned that this is a public health intervention, have even broader public health effects. And so I'd be curious at some point to find out, because this, what we're talking about is pro-sociality. And I know the literature around pro-sociality shows how people who are then feeling more connected, they're more cognizant of their fellow human beings, are more likely to follow through with public health measures like wearing masks during pandemics or getting vaccinated, or even just self-care in more powerful ways. So this can really have even broader impacts than the immediate let's have everyone feel calmer, feel better in a healthcare setting.
Absolutely. People walk in with their stress, right? That just gets amplified there. And I was on a call with a head of a sizable health system, the head of patient experience. And he turned to me and he said, "We've never had patients spit on staff until the last year or two." And of course, verbal and physical aggression or violence has increased, which is a reflection of what people are feeling out in their communities. So the idea is, how do you extend this? And so we're working on that into a community to help people even before they get there. And your earlier point is also spot on. So people, emotions and behaviors are contagious. We mimic each other, often subconsciously, without really, and it happens very quickly without as much of that conscious recognition, of course. But in that mimicking, the emotions, right, these things are contagious. So if I come in angry or fearful, it spreads and to the next person. If I'm stressed and tense, that person picks up on it. And maybe they can, of course, mollify it somewhat, but there's a degree, and they're absorbing it from maybe they're absorbing it from multiple people. The same thing is true, though, for positive emotions. So what I imagine is people may see the media, but then they go and there's a second order. They go and interact with somebody. And the quality of that interaction will affect how that next person will go and pass it on, if you will, or spread it further. So if someone's getting tense, then and negative emotions are stronger than the positive ones and more impactful, that will channel through. So I imagine this as a way of microdosing folks to allow them to reconnect to their humanity, which then affects their subsequent interactions. And in like work from Nick Christakis and James Fowler on spread, right, of and relationships, there's a lot that can be very useful. Right? It's also instructive about why some of these things may have occurred, which has to do with contemporary media use. And there's so much anger that's out in the media, whether it's mainstream news or social media. There's a good amount of that. And I think that that's having an impact on people.
Yeah, so you've just described the ripple effects, which are the more direct effects of this. First, we're helping the individual, but it spreads through the connections that that individual is making in a more, what we call in positive psychology, there's more of that positivity resonance between that individual and the next individual and groups of people. And then you also mentioned something interesting that we haven't mentioned, I think, before on this podcast, which is the Christakis and Fowler construct of degrees of separation, and that there is this fascinating data where it was first became popular in a New England Journal of Medicine article about obesity, and that individuals who are obese, even 3 degrees of separation, people that they don't even know, tended to be more likely to be obese. But the similar thing on the positive side is happiness, and that those that experience true happiness and positive affect, 3 degrees of separation. There's something there. People they don't know, on the whole, there's a higher percentage of that self-reported happiness. Of course, we need more research, but it's fascinating to figure out how and why. But bottom line is, this is a good thing. Start with yourself and go. It will go much more broadly. So then that leads me to a question of, okay, so how does someone start personally? How does one start? And then for those who are either health practitioners or in other workplaces, how do they start to do that, that changing of their environment in this way?
So I guess the first thing is the conscious decision of this is a kind of change that you would like, because it isn't all up to the media, of course. It's really about people wanting to, make a difference, and that the media is there to help enable it or catalyze it, if you will. But with that in mind, as regards the media specifically, we license it. It's a very simple license. And if there's a television, we can access the television. If some practices may have digital signage, many will not. They will just have like cable television. But it's very easy to convert the television to play the media, just like many people will have like a Fire Stick on the back of their television. It's the same kind of idea, except there's a playlist. And if it's a hospital, we license it to hospitals and they put it on their own digital signage. The whole thing, honestly, is turnkey. And as you mentioned before, and thank you for that, it's really quite simple to implement. And there's a footnote. We have no problem. I have no problem with people creating their own kindness media and doing it themselves.
Mm-hmm.
This isn't about, we're not doing this this is not about making money. The licensing fees, we have to pay our bills. But this is about making a difference and helping folks. So if you'd like to put on your own, I'm happy to try to help with that too. It's really about creating a cultural shift. So, and I hope that answered the question. And people can reach out to me. My name is David Fryburg again. It's Envision Kindness is the organization, and you can reach out to me through the website. It's very easy. And we seize the opportunities, because every person is an opportunity.
Well, thank you. And Envision Kindness clearly is a very unique and sounds like an amazing resource. And you've also mentioned a couple of books like the Compassionomics, which I didn't know about. So I'm going to have to look into that. Any other resources or what other groups, organizations, books, people are working in this space if people want to learn even more?
There are a good number of folks that are working in the compassion space in healthcare, like the Schwartz Center and folks that are also working IHI on joy at work, etc. For this specific kind of work, if somebody's interested in about the media, we've also published in peer-reviewed journals. And they can take a look at that, which goes into depth, as well as some of the studies we've done. And in the last paper I published, it was last year, it was also on framing the need for kindness against incivility, or unkindness. So it's important for your listeners to also know, if they haven't heard this, that even simply witnessing someone being unkind to another person affects the a viewer's cognitive function. Their clinical performance drops, and it can drop precipitously. So more medical errors and patient dissatisfaction and teamwork errors occurred due to incivility. So that paper focused on the value proposition of kindness as looking at through the lens of incivility in healthcare. That should probably give folks enough to read if they really want to dive in. And I hope that that's helpful.
Thank you for that. And that's so fascinating, and gets me excited to have such a simple yet powerful way to help ourselves, our patients, and beyond. So as we close, do you have any single takeaway message that you'd like to leave our listeners with?
Thank you for listening to me. And hearing my story, and I hope that it was of help, and I wish everyone who's listening well. And thank you, Liana, for the privilege of being on your podcast.
Thank you, David. So that was David Fryburg as our guest today. And thank you to our listeners for joining us. And we hope to see you again on one of these podcasts. Please subscribe to our channel, the Global Positive Health Institute. And in the meantime, be well, take care. Bye-bye.